In the bustling heart of a sprawling metropolis, where the city's rhythm was set by the unrelenting hum of activity, there stood a hospital. It was an imposing structure, its tall glass windows reflecting the sun's rays during the day and casting a luminous glow at night. This hospital was not just any medical facility. It was a beacon of hope for many and a last resort for others. Known for its state-of-the-art equipment, highly skilled staff, and dedication to patient care, it was a place where lives were both saved and transformed. However, behind its pristine reputation and the seamless operation of its emergency rooms, surgical theaters, and intensive care units, lay stories untold, stories of sacrifice, compassion, and sometimes bitter injustice. Within this hospital worked a surgeon whose name, though not widely known outside the hospital walls, was spoken with deep respect and admiration by his colleagues and patients alike. Dr. Rafael Mendoza was a man in his early 40s, with a quiet demeanor that belied the intensity with which he approached his work. He was not a surgeon who sought the spotlight or accolades. Instead, he found fulfillment in the precision of his scalpel, the rhythm of the operating room, and the satisfaction of seeing his patients recover and thrive. His path to becoming a surgeon had been marked by relentless dedication and a deep-seated belief that every life was precious, regardless of a person's social status or financial means. Doctor Mendoza's days were often long and grueling, filled with back-to-back surgeries, consultations, and the constant juggling of priorities that came with working in one of the city's most prestigious hospitals. Yet, despite the demands of his profession, he always made time for the small acts of kindness that defined his character. Whether it was sitting with a nervous patient before surgery to offer words of reassurance, or checking in on a recovering patient after his shift had ended, Dr. Mendoza embodied the very essence of what it meant to be a healer. But it was not just his technical skill and bedside manner that set him apart. Dr. Mendoza was known for his unwavering commitment to his patients, particularly those who were marginalized or vulnerable. He understood, perhaps better than most, that the hospital was often the last refuge for many who had nowhere else to turn. This understanding was rooted in his own experiences growing up in a modest neighborhood, where access to quality healthcare was a luxury few could afford. He had witnessed firsthand the despair of families who could not pay for essential medical treatments and the devastating consequences that followed. These memories had stayed with him, shaping his approach to medicine and fueling his desire to make a difference. The story that would ultimately lead to Dr. Mendoza's unjust dismissal began, as many stories of injustice do, with a simple act of compassion. It was a cold evening in late autumn when the event that would change the course of his career unfolded. The wind howled outside the hospital's thick walls, and the first hints of winter were in the air. The emergency room was, as always, a hive of activity, with doctors and nurses moving swiftly between patients, their expressions a mix of urgency and calm professionalism. Among the many who sought help that night was a young boy, no older than 10, who was brought in by a concerned bystander. The child was shivering, his face pale and drawn, and he clutched his side in obvious pain. His clothes were tattered, and his shoes were worn thin, clear signs of a life lived in poverty. The boy's eyes, wide with fear, scanned the unfamiliar surroundings of the emergency room, searching for something, anything, that might offer him comfort. The triage nurse, upon seeing the boy's condition, immediately recognized the severity of the situation. She quickly ushered him into one of the examination rooms, where he was assessed by a junior doctor. It was evident that the boy was in critical condition, suffering from acute appendicitis that had likely progressed to a rupture. The doctor knew that time was of the essence. Without immediate surgery, the boy's chances of survival were slim. But as the doctor prepared to admit the boy for surgery, he hesitated. The hospital's strict policies regarding payment and insurance came to the forefront of his mind. This was not a free clinic, and the boy had no insurance, no guardian to sign consent forms, and no way to pay for the emergency surgery he so desperately needed. The doctor was torn between the protocol that dictated his actions and the oath he had taken to save lives. It was at this critical juncture that Dr. Mendoza entered the scene. He had been finishing up another surgery when he was informed of the boy's condition. Without a moment's hesitation, he made his way to the emergency room. As soon as he saw the boy, he knew what needed to be done. The situation was dire, and there was no time to waste. Doctor Mendoza's reputation within the hospital was such that when he made a decision, others followed without question. He quickly instructed the staff to prepare the operating room, and without waiting for the bureaucratic wheels to turn, he began to scrub in for surgery. The boy, now barely conscious, was whisked away, and within minutes, the surgical team was assembled in the operating room. The atmosphere was tense but focused. The team worked with precision, guided by Dr. Mendoza's calm but authoritative presence. As the surgery progressed, the full extent of the boy's condition became apparent. The appendix had indeed ruptured, and the infection had spread, complicating the procedure. But Dr. Mendoza, with his years of experience and steady hands, navigated the complexities with skill. The hours ticked by, and finally, as the first light of dawn began to creep through the windows, the surgery was completed. The boy was stable, though his recovery would be long and fraught with challenges. Dr. Mendoza, exhausted but relieved, knew that they had given him a fighting chance. As he removed his gloves and exited the operating room, he was met with murmurs of admiration from his colleagues. They knew that without Dr. Mendoza's decisive action, the outcome could have been tragically different. However, what should have been a moment of quiet triumph was quickly overshadowed by the harsh realities of the institution in which Dr. Mendoza worked. The hospital's administration was less concerned with the life that had been saved and more with the protocol that had been breached. When it came to light that the surgery had been performed without prior payment or insurance authorization, the response was swift and unforgiving. Dr. Mendoza was summoned to a meeting with the hospital's board of directors. It was a formal affair, held in a large conference room with imposing oak furniture and floor-to-ceiling windows that offered a panoramic view of the city. The room was filled with people in suits, their expressions a mix of disapproval and detachment. As Dr. Mendoza took his seat, he felt a sense of foreboding wash over him. He had faced many difficult situations in his career, but this felt different, colder, more calculated. The chairman of the board, a man whose primary concern was the hospital's financial bottom line, began the meeting with a tone of controlled irritation. He acknowledged Dr. Mendoza's skill as a surgeon, but quickly shifted the focus to the issue at hand, the unauthorized surgery. The chairman cited hospital policy, emphasizing the importance of adhering to procedures, particularly when it came to financial matters. He pointed out that by performing the surgery without securing payment or insurance authorization, Dr. Mendoza had put the hospital at risk of financial loss and legal liability. Dr. Mendoza listened in silence, his face a mask of calm, though inside, he was seething with frustration. He tried to explain the circumstances, that there had been no time to seek authorization, that the boy's life had been in immediate danger, but his words seemed to fall on deaf ears. The board was not interested in the nuances of the situation. They were focused solely on the breach of protocol. After what felt like an eternity, the chairman delivered the final verdict. Dr. Mendoza was to be dismissed from his position, effective immediately. The decision was framed as a necessary action to uphold the hospital's standards and policies. But to Dr. Mendoza, it felt like a betrayal of everything he had stood for as a doctor. As he left the meeting, his career in ruins, Dr. Mendoza couldn't help but reflect on the irony of the situation. He had dedicated his life to saving others, often at great personal cost, and yet here he was punished for doing what he believed was right. The hospital, once a place where he had found purpose and meaning, now felt like a cold, impersonal machine, more concerned with profits than with people. The news of Dr. Mendoza's dismissal spread quickly through the hospital, and the reactions were mixed. Some of his colleagues were outraged, seeing it as a gross injustice, while others, though sympathetic, felt powerless to challenge the administration's decision. Patients who had been under Dr. Mendoza's care were shocked and saddened, many of them expressing their gratitude and support in letters and phone calls. But for Dr. Mendoza, the loss was deeply personal. He had not just lost his job, he had lost a part of himself. The hospital had been more than just a workplace. It had been a place where he had poured his heart and soul into his work, where he had built relationships with patients and colleagues, and where he had found a sense of purpose. Now, that was all gone, taken away in the name of policy and procedure. As he walked out of the hospital for the last time, Dr. Mendoza couldn't shake the feeling that something fundamental had changed, not just in his life, but in the very fabric of the medical profession. The experience left him questioning the values that governed the institutions where he had once felt so at home. He wondered what had happened to the idea that medicine was about healing, about caring for the most vulnerable, and about making decisions based on what was right, rather than what was profitable. The young boy, who had unknowingly been at the center of this storm, remained in the hospital, recovering from his surgery. He was unaware of the turmoil his presence had caused, and for that, Dr. Mendoza was grateful. The boy had suffered enough, and the last thing he needed was to be burdened with the knowledge that his life had come at such a high cost to another. But for Dr. Mendoza, the question lingered. How could a system that was supposed to save lives be so quick to discard those who were most committed to that very mission? The answer, he realized, was not simple, and it was a question that would stay with him long after the dust had settled. This introduction sets the stage for the complex and emotionally charged story that follows, drawing the reader into the world of Dr. Mendoza and the challenges he faces in a system that often prioritizes profit over compassion. The narrative explores themes of morality, justice, and the human cost of rigid institutional policies, inviting readers to reflect on the broader implications of Dr. Mendoza's experience. The decision Dr. Rafael Mendoza made on that cold autumn evening was neither impulsive nor reckless. It was born from a deep well of experience, a moral compass finely tuned over years of witnessing the fragility of life and the stark inequalities that existed in the world of healthcare. As he stood in the dimly lit corridor of the hospital, moments before the emergency surgery, Dr. Mendoza was acutely aware of the weight of the choice before him. The young boy on the operating table had no name in the system, no insurance, no guardian to sign the necessary forms. He was a nobody in the eyes of the bureaucracy, but to Dr. Mendoza, he was everything that mattered in that moment. A life on the brink, a child in desperate need of help. The ethical dilemma Dr. Mendoza faced was one that had haunted him for years. How many times had he been forced to confront the harsh reality that the quality of care a patient received was often directly proportional to their ability to pay? How many lives had he seen lost not because of the limitations of medical science, but because of the barriers erected by a system that valued profit over people? These were questions that had kept him awake at night, questions that gnawed at the very core of his being as a doctor. He had sworn an oath to do no harm, to treat all patients to the best of his ability. But what was he to do when the system itself seemed designed to inflict harm on the most vulnerable? In the split second it took for Dr. Mendoza to decide to go ahead with the surgery, he weighed the risks and the consequences. He knew the hospital's policies inside out. He knew that performing surgery without prior payment or insurance approval was a violation of protocol, one that could lead to disciplinary action or worse. But he also knew that to delay the surgery, to wait for the bureaucratic wheels to turn, would be to sign the boy's death warrant. The infection from the ruptured appendix was spreading rapidly, poisoning the boy's young body, and there was no time to lose. The operating room was a sanctuary for Dr. Mendoza, a place where the chaos of the outside world faded away, leaving only the patient and the task at hand. As he scrubbed in, he mentally prepared himself for the procedure. He had performed countless surgeries over the years, each one unique, each one a test of his skill and resolve. But this surgery felt different, more urgent, more personal. The boy on the table was a symbol of everything Dr. Mendoza had fought for throughout his career. The belief that every life, no matter how small or insignificant it seemed to the outside world, was worth saving. The surgical team, handpicked by Dr. Mendoza for their expertise and professionalism, moved with practiced precision. The room was filled with the soft beeping of monitors, the hum of the ventilator, and the occasional clink of surgical instruments. The boy's frail body was prepped and ready, his chest rising and falling rhythmically under the influence of the anesthesia. Dr. Mendoza took a deep breath, steadying himself. Before making the first incision, as the scalpel pierced the boy's skin, Dr. Mendoza's mind was fully focused on the task before him. The infected appendix was located quickly, its ruptured state confirming the severity of the situation. The infection had spread farther than anticipated, and the surgical team had to work quickly to clean the abdominal cavity and remove all traces of the contamination. It was delicate, meticulous work, the kind that demanded absolute concentration. There was no room for error, no margin for mistake. Yet, even in the midst of this life and death situation, Dr. Mendoza's thoughts wandered briefly to the implications of his decision. He knew that what he was doing was right, morally, ethically, and medically. But he also knew that right didn't always align with the rules. The hospital's administration, with its focus on financial viability and adherence to policy, might not see things the same way. In their eyes, Dr. Mendoza's actions could be construed as insubordination, a reckless disregard for the procedures that were in place to protect the institution. But Dr. Mendoza had long ago decided that his duty was to his patients first and foremost. If that meant bending the rules, then so be it. The surgery progressed steadily, each step bringing the boy closer to safety. Dr. Mendoza's hands moved with the precision of a master craftsman, his years of training and experience evident in every movement. He was in his element, fully immersed in the task of saving a life. The boy's small body seemed even more fragile under the harsh lights of the operating room, a stark reminder of the vulnerability of youth. Dr. Mendoza felt a surge of protectiveness as he worked, a determination to see this boy survive, to give him a chance at a future. As the surgery neared its conclusion, Dr. Mendoza began to feel a sense of relief. The most critical phase was over. The infection had been cleaned, the damaged tissue removed, and the boy's vital signs were stable. But the relief was tempered by the knowledge that this was only the beginning. The boy's recovery would be long and arduous, and he would need close monitoring and care in the days and weeks to come. But Dr. Mendoza was prepared to see it through. He would visit the boy regularly, ensuring that he received the best care possible. He had already decided that he would cover any additional costs out of his own pocket if necessary. This boy, who had come into the hospital alone and without hope, would not be abandoned. Once the surgery was complete, Dr. Mendoza stepped out of the operating room, peeling off his gloves and mask. He was met by a group of nurses and a junior doctor, all of whom had been anxiously awaiting the outcome. Their faces reflected a mixture of admiration and concern. They knew the risks Dr. Mendoza had taken, and they respected him all the more for it. But they also knew that there would be repercussions. Dr. Mendoza's immediate concern was the boy's post-operative care. He gave detailed instructions to the nursing staff, ensuring that the boy would receive the necessary antibiotics, pain management, and supportive care. The next 48 hours would be critical, and Dr. Mendoza planned to stay close by, ready to intervene if any complications arose. But even as he focused on the boy's care, he couldn't ignore the growing sense of unease. He knew that the hospital administration would soon be made aware of the situation, and that a reckoning was inevitable. As the hours passed and the boy began to stabilize, Dr. Mendoza found himself alone in the quiet of his office. The weight of the day's events settled heavily on his shoulders. He had saved a life, and yet he knew that his actions would not be celebrated. Instead, they would likely be scrutinized, criticized, and possibly condemned. The hospital's policies were clear, and while Dr. Mendoza had acted out of necessity, he had also acted outside the bounds of those policies. In a system where rules and regulations often took precedence over individual judgment, he knew that his future at the hospital was now uncertain. But Dr. Mendoza was not a man easily swayed by fear or doubt. He had faced challenges before, both in his professional and personal life, and he had always emerged stronger. He believed in what he had done, and he was prepared to defend his actions. The boy's life had been at stake, and in Dr. Mendoza's mind, that justified any risk he had taken. He would face whatever consequences came his way with the same resolve and integrity that had guided him throughout his career. The following day, as Dr. Mendoza made his rounds, he was approached by a member of the hospital's administration. The man was polite but firm, informing Dr. Mendoza that he was required to attend a meeting with the board of directors later that afternoon. The tone of the conversation left little doubt that the meeting would be a formal inquiry into the events of the previous night. Dr. Mendoza nodded, thanking the man for the information, and continued on his rounds, his mind already preparing for the confrontation that lay ahead. When the time for the meeting arrived, Dr. Mendoza entered the boardroom with his head held high. The room was filled with familiar faces, colleagues, administrators, and the hospital's legal counsel. The atmosphere was tense, the air thick with unspoken judgment. Dr. Mendoza took his seat, facing the chairman of the board, a man known for his strict adherence to policy and his unwavering focus on the hospital's financial performance. The chairman wasted no time in addressing the issue at hand. He acknowledged Dr. Mendoza's skill as a surgeon and his long-standing commitment to the hospital, but quickly moved on to the matter of the unauthorized surgery. The chairman's words were measured, his tone neutral, but there was an underlying current of disapproval. He outlined the hospital's policies, emphasizing the importance of securing payment or insurance approval before any procedure was performed. He pointed out that while the boy's situation was tragic, it did not justify circumventing the established protocols to Dr. Mendoza listened attentively, his expression calm. When the chairman finished speaking, Dr. Mendoza took a moment to gather his thoughts before responding. He explained the circumstances in detail, the severity of the boy's condition, the lack of time for bureaucratic processes, and the ethical obligation he felt to act immediately. He spoke of the fundamental principles of medicine, of the duty to save lives, and of the human cost of inaction. His words were passionate yet controlled, a reflection of the depth of his convictions. But as Dr. Mendoza spoke, he could see that his words were not having the desired effect. The board members listened politely, but their expressions remained impassive. To them, this was not a question of ethics or morality. It was a matter of procedure. The rules were in place for a reason, they argued, and to allow exceptions would undermine the integrity of the system. Dr. Mendoza's actions, while understandable on a human level, had violated the protocols that ensured the hospital's smooth operation and financial stability. The meeting dragged on, with both sides presenting their arguments. Dr. Mendoza remained steadfast, defending his decision with logic and compassion. But deep down, he knew that the outcome was already determined. The hospital was an institution, and like all institutions, it was bound by rules and regulations. Those rules did not account for the nuances of individual cases, for the moral dilemmas that doctors like Dr. Mendoza faced on a daily basis. In the eyes of the board, Dr. Mendoza had crossed a line, and there would be consequences. When the meeting finally concluded, Dr. Mendoza was left with a sense of inevitability. He had done everything he could to explain and justify his actions, but he knew that the hospital's priorities lay elsewhere. The decision to perform the surgery had been his, and he would bear the responsibility for it. As he left the boardroom, the gravity of the situation weighed heavily on him. The boy was recovering, but Dr. Mendoza's future at the hospital was now in jeopardy. Over the next few days, Dr. Mendoza continued to care for the boy, visiting him regularly, monitoring his progress, and ensuring that he received the best possible treatment. The boy's condition improved steadily, and he began to regain his strength. Dr. Mendoza took solace in the knowledge that his actions had saved a life, even as the shadow of his impending fate loomed over him. The hospital's administration, meanwhile, began its formal investigation into the events surrounding the surgery. Statements were taken, reports were filed, and the legal department reviewed the potential ramifications. Dr. Mendoza was called in for additional meetings, each one more grueling than the last. The questions were pointed, the atmosphere increasingly adversarial. Dr. Mendoza maintained his composure throughout, answering honestly and standing by his decision. As the investigation progressed, word began to spread through the hospital about Dr. Mendoza's situation. His colleagues, many of whom had admired and respected him for years, were divided. Some saw him as a hero, a doctor who had put his patient's life above all else. Others, while sympathetic, worried about the precedent his actions might set. If one doctor could bypass the rules, what would stop others from doing the same? The tension within the hospital grew, with whispers and speculation adding to the already charged environment. For Dr. Mendoza, the support of his colleagues was both comforting and bittersweet. He appreciated the gestures of solidarity, the quiet words of encouragement, but he also knew that his position was precarious. The hospital was not just his workplace. It was his life's work, the place where he had dedicated years of his career to healing and saving lives. The thought of losing it all because of one decision, even one he believed was right, was a bitter pill to swallow. As the days turned into weeks, the hospital's board finally reached a decision. Dr. Mendoza was summoned to yet another meeting, this time with the hospital's CEO and the chairman of the board. The atmosphere was solemn, the stakes higher than ever. Dr. Mendoza entered the room with a sense of resignation, knowing that whatever was decided, he had no regrets about what he had done. The CEO, a man who had always valued Dr. Mendoza's contributions to the hospital, spoke first. He acknowledged the difficult position Dr. Mendoza had been in and praised his dedication to patient care. But he continued, the hospital's policies were clear, and they existed to protect both the institution and its patients. Dr. Mendoza's decision to perform the surgery without following the proper channels, while understandable, had put the hospital at risk, financially, legally, and reputationally. The chairman of the board then delivered the final verdict. Dr. Mendoza would be dismissed from his position, effective immediately. The decision was framed as a necessary step to maintain the integrity of the hospital's operations. Dr. Mendoza listened quietly, his expression unreadable. He had expected this outcome, but that did not make it any easier to accept that as he left the hospital for the last time, Dr. Mendoza felt a mix of emotions: anger, sadness, and a deep sense of injustice. He had done what he believed was right, what he knew was right, and yet he was being punished for it. The boy whose life he had saved was now out of danger, but Dr. Mendoza's own life had been irrevocably changed. He was no longer a surgeon at the hospital he had once called home. He was a man without a place, a doctor without a practice. But even in the face of this profound loss, Dr. Mendoza knew that he would not give up. He had spent his life fighting for what he believed in, and this would not be the end of that fight. There were other ways to heal, other places where his skills and compassion could make a difference. The system might have rejected him, but his purpose remained unchanged. Dr. Mendoza would continue to serve, to care, and to save lives, no matter where that path might lead him. The news of Dr. Rafael Mendoza's dismissal spread through the medical community like wildfire, igniting a firestorm of controversy, debate, and outrage. His abrupt removal from the hospital where he had served with distinction for years sent shockwaves through not only his colleagues, but also the broader public. For many, the decision to fire a dedicated surgeon for saving the life of a child without compensation seemed incomprehensible, a stark reminder of the cold, profit-driven mechanisms that often lurk beneath the surface of healthcare institutions. Dr. Mendoza's case quickly became a flashpoint in a much larger conversation about the role of morality, ethics, and humanity in medicine. The media caught wind of the story, and within days, it became a nationwide scandal. Headlines splashed across newspapers and television screens painted the picture of a heroic doctor who had been punished for doing what was right. Social media platforms erupted with opinions, hashtags, and calls to action. Hashtag Justice for Mendoza trended as thousands expressed their support for the surgeon who had risked everything to save a life. Yet, as the public rallied behind Dr. Mendoza, the hospital where he had worked remained largely silent. Their official statement, released shortly after the news broke, was a carefully worded document that emphasized the importance of adhering to hospital protocols and maintaining the financial stability of the institution. It acknowledged Dr. Mendoza's contributions but stood firm on the decision to dismiss him, citing the need to uphold the rules that govern the hospital's operations. The statement did little to quell the growing tide of public opinion, which increasingly viewed the hospital as an unfeeling monolith, more concerned with its bottom line than the well-being of its patients. Patients who had once trusted the hospital with their care began to question whether their lives would be valued only as long as they could pay. The hospital's reputation, once impeccable, began to tarnish under the relentless scrutiny of the public and the press. Dr. Mendoza, meanwhile, found himself in the eye of this storm, a reluctant hero thrust into the spotlight by circumstances beyond his control. The days following his dismissal were a blur of interviews, phone calls, and meetings with lawyers and supporters. His home became a makeshift headquarters for the growing movement that had sprung up in his defense. Friends, colleagues, and even strangers reached out to offer their support, their words of encouragement serving as a balm to the wounds left by his abrupt departure from the hospital. Despite the outpouring of support, Dr. Mendoza remained deeply conflicted. He had never sought fame or recognition. He had simply done what he believed was right. The idea that he had become a symbol of something larger, a figurehead in the fight against the commercialization of healthcare, was both humbling and overwhelming. He struggled with the attention, with the knowledge that his personal and professional life had become fodder for public debate. The spotlight was a harsh and unforgiving place, and Dr. Mendoza was not sure he was prepared for the weight of the responsibility that came with it. As the days turned into weeks, the case began to take on a life of its own. Lawyers and advocacy groups reached out to Dr. Mendoza, offering to represent him in a potential legal battle against the hospital. They argued that his dismissal was not only unjust, but also illegal, a clear violation of the ethical standards that should govern any medical institution. They pointed to precedents, to cases where doctors had been wrongfully terminated for similar actions, and they assured Dr. Mendoza that they could win. But Dr. Mendoza was hesitant. The idea of suing the hospital, of engaging in a protracted legal battle, was not appealing to him. He had spent his life in the pursuit of healing, not litigation, and the thought of dragging the institution he had once loved in a court filled him with a profound sense of sadness. He knew that a legal fight would be long, exhausting, and emotionally draining. It would consume his time, his energy, and possibly his spirit. And yet, there was a part of him that recognized the importance of standing up not just for himself, but for all the doctors who might one day find themselves in a similar situation. While Dr. Mendoza wrestled with the decision of whether or not to pursue legal action, the movement supporting him continued to grow. Protests were organized outside the hospital, with placards bearing slogans like "Healthcare, not wealthcare," and "Doctors, not dollars." The demonstrators were a diverse group: doctors, nurses, patients, activists, and concerned citizens, united by a shared belief that something fundamental had gone wrong in the way healthcare was being managed. The hospital, now under siege both in the media and on the streets, began to feel the pressure. Patient numbers dwindled as more and more people chose to seek care elsewhere, unwilling to support an institution that had, in their eyes, betrayed its most basic duty. The board of directors, which had once been so confident in its decision to fire Dr. Mendoza, now found itself facing a crisis of unprecedented proportions. The financial stability they had sought to protect was now in jeopardy, as the hospital's revenue plummeted and its reputation lay in tatters. In response to the growing crisis, the hospital's leadership attempted to shift the narrative. They issued a series of statements highlighting their commitment to patient care and their long history of community service. They pointed to the charitable work they had done, the free clinics they had supported, and the lives they had saved. But these efforts to rehabilitate their image were largely unsuccessful. The public, once lost, was not easily swayed by words alone. They demanded action, accountability, and above all, justice for Dr. Mendoza. Amid this turmoil, Dr. Mendoza's supporters launched a fundraising campaign to help cover his legal expenses and provide financial support while he was out of work. The response was overwhelming. Donations poured in from across the country, from people who had been moved by his story, from those who had experienced similar injustices, and from fellow healthcare professionals who understood all too well the pressures and ethical dilemmas doctors faced every day. The funds raised not only covered Dr. Mendoza's immediate needs, but also provided him with the resources to explore his options without the burden of financial strain. As the weeks went by, Dr. Mendoza found himself at a crossroads. The pressure to take legal action against the hospital was mounting, not just from his lawyers and supporters, but from within himself. He knew that if he walked away now, if he allowed the hospital to go unchallenged, it would set a dangerous precedent. It would send a message to other doctors that they too could be punished for doing what was right, that their careers could be destroyed for saving lives without regard for profit. But Dr. Mendoza also knew that a legal battle would come at a cost. It would mean reliving the events of that fateful night over and over again, subjecting himself to the scrutiny of lawyers, judges, and the public. It would mean dragging the boy's story into the spotlight once more, something Dr. Mendoza was reluctant to do. The boy had suffered enough, and Dr. Mendoza was determined to protect him from any further trauma. As he weighed his options, Dr. Mendoza began to seek counsel from those he trusted most: his family, his closest friends, and his former colleagues. They offered him advice, support, and sometimes conflicting opinions. Some urged him to fight, to stand up for what was right, and to hold the hospital accountable for its actions. Others cautioned him to think carefully about what a prolonged legal battle would do to his health, his well-being, and his future. In the end, it was a conversation with his daughter, Sophia, that helped Dr. Mendoza find clarity. Sophia, a law student who had been one of her father's staunchest supporters throughout the ordeal, sat with him one evening as they discussed the situation. She spoke passionately about the importance of justice, not just for him, but for all the doctors and patients who would be affected by the outcome of his case. But she also spoke about the personal toll it would take, the sacrifices he would have to make, and the battles he would have to fight. "Dad," she said, her voice filled with emotion, "you've always taught me to stand up for what's right, no matter how hard it is. But you've also taught me that sometimes the hardest decisions are the ones where there's no clear right answer. Whatever you choose, know that I'll support you. But just make sure it's something you can live with, something that won't break you in the end." Her words struck a chord with Dr. Mendoza. He realized that the decision before him was not just about justice. It was about preserving who he was, what he stood for, and what he had spent his life building. He could fight the hospital, and maybe he would win. But at what cost? Would the victory, if it came, be worth the personal and emotional price he would have to pay? Or would it leave him bitter and broken, a shadow of the man he once was? After much soul-searching, Dr. Mendoza made his decision. He would pursue legal action, not out of a desire for revenge, but out of a sense of duty to himself, his profession, and the patients he had sworn to protect. But he would do so on his own terms, with a clear understanding of the challenges ahead and a commitment to maintaining his integrity and compassion throughout the process. The decision to sue the hospital was met with mixed reactions. His supporters hailed it as a courageous step, a necessary fight for justice in a system that all too often prioritized profit over people. But there were also those who questioned the wisdom of his choice, who warned him of the potential fallout, both personally and professionally. Dr. Mendoza listened to all the voices, but in the end, he trusted his own judgment. He knew that this was the right path for him, even if it was fraught with difficulties. The legal battle that followed was every bit as grueling as Dr. Mendoza had anticipated. The hospital's lawyers were formidable, well-funded, and determined to protect their clients' interests. They sought to discredit Dr. Mendoza, to paint him as a rogue surgeon who had acted recklessly and put the hospital at risk. They dug into his past, looking for any mistakes or missteps they could use against him. But Dr. Mendoza was prepared. He had assembled a team of lawyers who believed in his cause and were committed to fighting for him. They countered the hospital's arguments with evidence of Dr. Mendoza's exemplary record, his countless hours of unpaid work in underserved communities, and his unwavering commitment to patient care. They brought in expert witnesses who testified to the ethical dilemmas doctors faced every day and the need for flexibility and compassion in the application of hospital policies. As the trial unfolded, the public remained captivated by the story. Courtrooms were packed, and news outlets provided daily updates on the proceedings. Dr. Mendoza's supporters continued to rally outside the courthouse, their numbers growing as more and more people became invested in the outcome of the case. It was no longer just about one doctor and one hospital. It was about the future of healthcare, about whether compassion and ethics would prevail over bureaucracy and profit. For Dr. Mendoza, the trial was a test of his endurance, both physically and emotionally. There were days when he felt drained, exhausted by the relentless pace and the constant pressure. But there were also moments of hope and inspiration, moments when he saw the impact his case was having on the broader conversation about healthcare in the country. He received letters from doctors, nurses, and patients who had been inspired by his stand, who thanked him for being a voice for those who often went unheard. Throughout it all, Dr. Mendoza remained focused on the boy whose life he had saved. In his quiet moments, he thought about that night in the operating room, about the decision he had made and the consequences that had followed. He knew that no matter what happened in the courtroom, he had done what was right, and that, more than anything else, gave him the strength to keep going. As the trial drew to a close, the tension in the courtroom was palpable. Both sides presented their final arguments, and the jury retired to deliberate. For hours, Dr. Mendoza waited, surrounded by his family, his legal team, and his supporters. The outcome was uncertain, and the stakes were high. But as he sat there, he felt a sense of peace. He had fought with everything he had, and whatever the verdict, he knew he could live with the choices he had made. When the jury finally returned, the room fell silent. The foreperson stood and read the verdict in favor of Dr. Mendoza. The courtroom erupted in cheers, tears, and applause. Dr. Mendoza felt a wave of relief wash over him. It was a victory not just for him, but for every doctor who had ever faced a similar choice, for every patient who had ever wondered if their life was worth more than the cost of their treatment. But as the celebrations continued around him, Dr. Mendoza remained thoughtful. The battle might have been won, but the war was far from over. The healthcare system was still flawed, still in need of reform. And while his case had shone a light on those flaws, it was just one step in a much larger journey. There was still much work to be done, and Dr. Mendoza knew that he could not rest on this victory. He would continue to fight, to advocate for a system that valued lives over profits, that put patients before policies. As he left the courthouse that day, surrounded by his family and supporters, Dr. Mendoza felt a renewed sense of purpose. His journey had been long and difficult, but it had also been worth it. He had stood up for what he believed in, and in doing so, he had sparked a movement, a call for change that would resonate far beyond the walls of the hospital where it had all begun. And so, Dr. Mendoza walked forward, ready to face whatever challenges lay ahead, knowing that he was not alone. He had a community behind him, a cause worth fighting for, and a future that, while uncertain, was full of possibilities. The path was still winding, still fraught with obstacles, but Dr. Mendoza was determined to see it through to the end. Because in the end, it was not just about him. It was about every life he had saved, every patient who had entrusted him with their care, and every person who believed in a world where healthcare was a right, not a privilege. And for that, Dr. Mendoza knew the fight was worth it. The courtroom victory was a powerful vindication for Dr. Rafael Mendoza, but it was only the beginning of a new chapter in his life. A chapter that would be defined not by the trials of the past, but by the opportunities and challenges that lay ahead. As the echoes of the jury's verdict faded, Dr. Mendoza found himself at a crossroads, his future uncertain but filled with possibility. To end the days following the trial, Dr. Mendoza became a figure of national interest. Interviews with news outlets and talk shows were scheduled, and his story was featured in documentaries and profiles that highlighted the complexities of his case and the broader issues it raised. Despite the attention, Dr. Mendoza remained grounded, focused not on the fame that had come his way, but on the purpose that had driven him from the start, the desire to heal and serve. But even as the public celebrated his victory, Dr. Mendoza knew that the wounds left by his dismissal from the hospital had not fully healed. The sense of betrayal he felt, the loss of a place that had once been his professional home, lingered in his heart. The hospital's cold, bureaucratic response to his actions had shaken him deeply, challenging his faith in an institution he had once revered. Despite the jury's decision, the relationship between Dr. Mendoza and the hospital remained strained. The board's refusal to acknowledge any wrongdoing or offer a formal apology was a bitter pill to swallow. While the court had ruled in his favor, awarding him damages and compensation for his unjust dismissal, the money did little to ease the pain of what he had lost. The trust that had been broken, the camaraderie with his colleagues, the pride he had once felt walking through the hospital's halls, all of it had been tainted by the ordeal. Yet, amid the bitterness, there was also a sense of hope. The public outcry and the attention brought by the trial had sparked a broader conversation about the state of healthcare, about the balance between profit and ethics, and about the role of compassion in medicine. Activists, lawmakers, and healthcare professionals began to rally around the issues raised by Dr. Mendoza's case, pushing for reforms that would ensure that no doctor would ever again face the kind of punishment he had endured for doing the right thing. As these conversations gained momentum, Dr. Mendoza found himself drawn into the movement for change. Invitations to speak at conferences, medical schools, and public forums poured in. While he had never seen himself as a public speaker or an activist, Dr. Mendoza recognized the importance of using his voice and experience to advocate for a better system. He accepted these invitations not out of a desire for attention, but out of a commitment to the cause that had become so central to his life. At first, the speaking engagements were daunting. Standing before large audiences, recounting the events that had led to his dismissal, and discussing the intricacies of healthcare policy were far removed from the operating room, where he felt most at home. But as time went on, Dr. Mendoza began to find his rhythm. His speeches, grounded in personal experience and driven by a deep sense of moral conviction, resonated with audiences. He spoke not just as a victim of a flawed system, but as a doctor who believed in the power of medicine to heal, uplift, and bring hope. Dr. Mendoza's message was clear. The healthcare system needed to change. It needed to prioritize patients over profits, to support doctors in making ethical decisions, and to ensure that access to care was a right, not a privilege. He called for a re-evaluation of hospital policies, for protections for doctors who acted in the best interests of their patients, and for a system that recognized the humanity at the core of medicine. The impact of Dr. Mendoza's advocacy was profound. His story became a rallying cry for healthcare reform, inspiring a new wave of activism and influencing the debate on national health policies. Lawmakers began to introduce bills aimed at protecting medical professionals who faced ethical dilemmas, while healthcare organizations started to reassess their policies and practices in light of the issues raised by his case. But while Dr. Mendoza's public life flourished, his personal journey toward healing was more complex. The loss of his position at the hospital had left a void in his life, a sense of displacement that no amount of public acclaim could fill. He missed the daily interactions with patients, the satisfaction of performing surgeries, and the camaraderie of working alongside his colleagues. The question of where he belonged now, after everything that had happened, weighed heavily on his mind. That it was during this period of uncertainty that Dr. Mendoza began to explore new ways to continue his work as a healer. The idea of opening his own clinic had always been in the back of his mind, but it had never seemed like a practical option while he was entrenched in the hospital system. Now, with his ties to that system severed, the idea began to take on new life. The concept of the clinic evolved gradually. Dr. Mendoza envisioned a place that would serve those who were often overlooked by the traditional healthcare system: patients without insurance, those from underserved communities, and anyone who needed care regardless of their ability to pay. It would be a clinic rooted in the principles that had guided him throughout his career: compassion, accessibility, and a commitment to treating every patient with dignity and respect. The road to establishing the clinic was not easy. Funding was a major challenge, as was finding a suitable location. But Dr. Mendoza was undeterred. He began reaching out to the network of supporters he had built during the trial, including those who had donated to his legal defense fund. He also tapped into the connections he had made with other healthcare professionals who shared his vision for a more equitable system. Through a combination of crowdfunding, private donations, and partnerships with local organizations, Dr. Mendoza was able to secure the resources needed to make his dream a reality. The clinic, located in a modest building in a neighborhood with limited access to healthcare, opened its doors to the public a year after the trial's conclusion. From the moment the clinic opened, it became clear that there was a deep need for the services it provided. Patients began arriving in droves, many of them people who had nowhere else to turn for medical care. Dr. Mendoza, along with a small but dedicated staff of doctors, nurses, and volunteers, worked tirelessly to meet the demand. The clinic operated on a sliding scale, with those who could pay doing so, and those who couldn't receiving care for free. The work was exhausting, the hours long, and the challenges numerous. But for Dr. Mendoza, it was also deeply fulfilling. He was once again doing what he loved: caring for patients, performing surgeries, and making a tangible difference in people's lives. The clinic became a beacon of hope in the community, a place where people knew they could receive compassionate, high-quality care regardless of their circumstances. As the clinic grew, so did its reputation. Word of Dr. Mendoza's work spread, and the clinic began to attract attention not just locally, but nationally. Health professionals from across the country reached out, offering to volunteer their time or donate resources. Medical students applied for internships, eager to learn from Dr. Mendoza and experience firsthand the kind of patient-centered care that was at the heart of his practice. The success of the clinic also had a ripple effect beyond its immediate surroundings. Other doctors, inspired by Dr. Mendoza's example, began to open similar clinics in their own communities. A network of free and low-cost clinics began to form, each one dedicated to providing care to those who had been left behind by the mainstream healthcare system. Dr. Mendoza's vision was becoming a reality, not just in his own clinic, but in communities across the country. Despite the clinic's success, Dr. Mendoza never lost sight of the larger battle for healthcare reform. He continued to speak out on the issues that had led to his dismissal and to advocate for changes that would protect both doctors and patients. He testified before Congress, met with policymakers, and worked with advocacy groups to push for legislation that would make healthcare more accessible and equitable. His efforts began to bear fruit. A number of states passed laws protecting doctors from retaliation when they acted in the best interests of their patients, and several hospitals implemented new policies designed to prevent situations like Dr. Mendoza's from happening again. The national conversation about healthcare shifted, with a growing recognition of the need to balance financial considerations with ethical and moral obligations. But for all the progress that was made, Dr. Mendoza knew that the fight was far from over. The healthcare system was vast and complex, and change was slow and often resisted by those with vested interests in maintaining the status quo. There were still too many people without access to care, too many doctors facing impossible choices, and too many institutions prioritizing profits over patients that as the years went by, Dr. Mendoza remained committed to his work at the clinic and to the cause of healthcare reform. He continued to see patients, to mentor young doctors, and to speak out on the issues that mattered most to him. He found fulfillment not in the accolades or the public recognition, but in the knowledge that he was making a difference, one patient at a time. In time. The clinic became more than just a place of healing. It became a symbol of what was possible when compassion and justice were placed at the heart of medicine. It was a place where people could come not just for medical care, but for hope, dignity, and respect. And it was a place where Dr. Mendoza could continue to live out his calling, to serve those in need, and to stand as a testament to the power of doing what is right, no matter the cost. Dr. Mendoza's journey was far from easy, and the scars of his past were still there, reminders of the battles he had fought and the price he had paid. But those scars also told a story of resilience, of courage, and of the unwavering belief that one person could make a difference. It was a story that inspired others, that challenged the status quo, and that in the end helped to create a better, more just world. As he looked back on the path he had traveled, Dr. Mendoza knew that the fight for a better healthcare system was not just his fight. It was a fight for everyone. And as long as there were people in need, as long as there were injustices to be addressed, he would continue to walk that path, driven by the same passion and purpose that had guided him from the beginning. The path ahead was still uncertain, and the challenges were still great. But Dr. Mendoza was ready. With his clinic, his voice, and his unwavering commitment to the cause, he knew that the journey was far from over. And as he moved forward, he did so with the knowledge that he was not alone, that he was part of a larger movement, a movement that was changing the world one step at a time.